Hypertension, if you look at the incidence in our country, then in the urban areas, the incidence is rapidly increased, and it is estimated about 25 to 30% of people have hypertension. And in the rural areas, it is little less, maybe about 15 to 20%. And the incidence of hypertension is slightly higher in males as compared to women. But if you look at the women after the menopausal age, then the incidence of hypertension steadily increases and it matches that of the men later on. In women, there is an additional issue. Many of them during their pregnancy can get pregnancy-induced hypertension. Now, as far as the risk factors are concerned for hypertension, they are the lifestyle-related issues which are common both in men as well as in women. But one thing we have seen that patients who have pregnancy-induced hypertension, these women tend to later on have hypertension much more. So that is an additional risk factor. Otherwise, the lifestyle and the genetic predisposition are the major risk factors for hypertension. And as we know, in most of the people for hypertension, there is no known cause. And very rarely we can attribute hypertension to one single cause like renal disease or some hormonal issues, but that is very, very rare. Usually hypertension is known as essential hypertension because we do not find any cause for hypertension.
What are the factors or steps one can take to prevent hypertension in women?
It is very important that we must change our lifestyle. Lifestyle changes have also been shown to reduce the incidence of hypertension and also control hypertension to some extent. Now, what are these lifestyle measures? First of all, have more of fruits and vegetables. Increase the intake of potassium in the form of vegetables and fruits. Do not add extra salt. Per day, restrict your salt consumption to approximately 5 grams of salt per day, not more than that. And most of this salt comes from in the invisible way. So the foods which are having high salt content should be avoided, like papad, chutneys, the fast food, they all have very high salt content. The third most important way is to be physically active. And one simple thing I tell everyone, all my patients, is to walk 10,000 steps every day. And people who like to enjoy some sports, they must do some good aerobic exercise, at least moderate intensity, in a week for about 150 minutes. And this should be spread as much as possible. So just by taking care of the lifestyle, by reducing the weight, by taking care of the salt intake, by being physically more active, and also avoiding smoking and alcohol, blood pressure can be taken care to a significant level. And it helps, and in fact many patients would still require medicines, but the number of medicines required would be less.